Well, good morning. It's Lee Ankrum here from the Ankrum Institute. So this morning I feel compelled to talk about that joint that is called the mortise, but which is actually tibia, tibia, I'm a little rusty at this, and fibula, and the talus from the foot, which goes in between. So those three bones make up the mortise, which is the ankle joint. I want you to notice the construction here, the fibula. Look at how much lower. This would be a right leg because we're looking at this from the front, and this is the shin on the tibia right here, and the fibula is much longer. That ankle is actually more inferior than it is on the inside of the leg here on the tibia. Okay, so we're looking at the construction here, and it looks like a little square in here. The interesting thing is that the talus, I'm going to turn the page here and find where we are. Okay, so the talus, look at the construction here. You have the little square, you have the fibula, and there's the talus that fits right inside. The talus that fits right inside. So what happens is, and I'm going to explain why this is so important. I have a little bit of a leg here, okay, a foot and an ankle here, is when dorsiflexion happens, when the toes move towards the nose, what happens here is the two ankles widen to allow the talus to move into place. If they get stuck in any way, and the big one that gets stuck most of the time is the tibia, because tibia is weight-bearing where the fibula is not. The tibia is weight-bearing, and the tibia is also one that if you jump or a shock wave goes in, it goes into the tibia, and the tibias get frozen a lot. Now your tibia is not supposed to move a lot, just enough to accommodate that talus actually coming up and in between the bones when I dorsiflex the foot, right? And each step you take, each step or running step that you take dorsiflexes the foot. So that's supposed to happen every time you walk, every time you take a step. When it doesn't happen on the tibia, okay, we've got some consequences. So here's the deal. We've got some consequences. So I'll talk about the tibia consequences first, and then I'll talk about the fibula consequences. Let me move over to the next page in the book, and here it shows the back of our leg. So one of the things that's supposed to happen when the dorsiflexion, I'll bring this back. So when dorsiflexion happens, you see dorsiflexion happens, then what happens is that there is a lengthening, of course, and a stretching of all of the posterior muscles, gastroc, soleus, that all lead into this Achilles tendon, and it attaches onto the heel, okay? So in a dorsiflexion, this all gets stretched, and that's actually what's supposed to happen. But here's what happens when my tibia is frozen, and, well, actually, let's say both my tibia and my fibula are frozen. This, although I don't have a picture of the whole back of the leg with the hamstring included up here, will get way overstretched, because what happens here is that when I can't dorsiflex, in order to make the step happen, all of the tissues in the whole back of the leg actually have to overstretch around in order for me to take the step. That is if my fibula and my tibia are frozen closed, which is super common. Anybody that's sprained their ankle, anybody that's, a lot of things, anybody that's a lot of stuff happens where this complex here gets frozen, it's a biggie. It's a very biggie. Okay, so now let's talk a little bit about the fibula. So if the fibula is not frozen and the fibula is actually widening, right? It's going lateral. When this happens, then somebody will pronate. So let me see if I can get this foot in here. Whoop, here's the foot. So when that happens, what will happen is somebody will walk on the inside of the foot, because as you can see, The fibula being on the outside, this opens, your tibia does not. You're going to flatten and walk inside here. So the foot will pronate, you'll have pronation. There's lots of reasons as well for pronation besides the fibula being the only bone at the bottom of the leg working. But it certainly assists in a pronation pattern for you. You know, let me know if you guys want me to do like a one-day actual class on how you work on things like this, simple things like this. I would feel comfortable actually doing a video and lectures and a few demonstrations that you could actually sign up for. So let me know what you think about that, and I'll get Alicia and we can set that up, and you can link to it through our website. So anyway, this is just a little piece on how just the ankle itself works. That it's not even all the other parts, just the ankle itself. I hope that this kind of gives you a little clue around some things, especially body workers for the future. So I look forward to hearing from any of you. And oh my gosh, stay safe. I'm here at Lone with Ruby and Elizabeth Taylor. We're doing it. All right, you guys. Love you all. Lee.